Steve, thank you so much for joining me today.
Yeah, you're welcome. Pleasure.
So what are some of the evidence-based prevention strategies amid COVID-19 that have the ability to incorporate AI?
I think probably in terms of evidence-based, that's a preloaded term. I think that more or less in the world of treatment, because once a diagnosis is made, we can better understand and talk about hard science. And I think what we're seeing a lot with the AI and thinking about how can it help with treatment, again, going back to some of the early identification, some of these mobile devices, your smartwatch or your fitness tracker, many of them actually have an oxygen sensor in there that can measure your oxygen saturation. And oftentimes, again, detect changes in your oxygen saturation earlier before the onset of symptoms, or even though you may have a diagnosis, these sensors can detect that you may be going into trouble, into developing a more complicated or severe case before you feel it symptomatically. So I think that is one area where we can see a lot of potential promise in terms of notifying the individual patient, like, hey, we notice there's been a change in your oxygenation level, maybe you should get this checked out. Similarly, we certainly are seeing a lot of research and interest for the patients who do have the diagnosis and got admitted to the hospital. You all may have heard that a significant portion of the mortality associated with COVID-19 are those who end up getting put on the ventilator in the ICU. What if using AI, we're reading the records in the electronic medical records and reading those data, and then identifying patients who are about to experience these clinical demise and pick them up earlier, right? Instead of waiting till they have developed into a full-blown respiratory failure, if we can identify those patients sooner, do other things that may have an impact in changing the trajectory of the outcome. We're talking here in the third week of June. I don't know when people are going to encounter this information, but earlier this week, we've seen some very positive results from the UK talking about the use of dexamethasone in changing the outcome or improving the outcome of patients with COVID-19. Wouldn't it be nice if we can actually utilize AI to identify those patients that may benefit the most from this treatment so that we can administer them much earlier and making sure that those patients have the best chances of surviving this illness?
So AI can also help decide how to distribute the different potential treatments.
I think that is a fair way to summarize that, because right now I think we are still in the early stages of understanding these diseases. We're even trying to just find out what drug may work. Perhaps some of these drugs may work better in one subset of patients versus the other set of patients. So those are things that we're still trying to learn right now. Certainly, everyone who have received some of these drugs will not have a good outcome. So what is the difference between those patients who didn't have a good outcome versus those who do have a good outcome? So then we don't indiscriminately give these medications that have potential side effects, right? Some of your audience are pharmacists. You're well aware that steroids can change your glucose metabolism. It can have significant side effects as well. So if the use of this drug is not likely to lead to a good outcome, why expose our patients to the risk of having some of these side effects? And I think that's very important work that needs to be done in the next few weeks as we understand this disease more and more to identify who are likely to benefit and who are not.
So you mentioned that pharmacists can use AI to identify side effects. So what role do you see pharmacists having in implementing AI into their practice during the pandemic and then going forward as well?
That's a great question. I think some of the issues related to COVID-19 is that some of the patients will inevitably develop what we call secondary bacterial infections because their body is being attacked by the virus. So as a result, the immune system is weakened. So a certain subset of those patients will develop other more common, bacterial pneumonia, for example, or things that we see in hospital all the time, maybe a bacteria in the blood, stuff like that. Or maybe because they've been intubated for a long time, that tube that is down their throat, that can set them up for some of these infections. I think leveraging AI and then thinking about some of the early detection systems or natural language processing. Electronic health record contains a lot of data, including a lot of the laboratory results, vital signs, and a lot of the patient status. A lot of the human input, for example, when a nurse sees something or a doctor sees something on the physical exam, all that data is still captured in a format that is not discrete. In other words, it's not a yes, no, it's not a number. So a lot of these are just natural sentences that we would say, you know, this particular patient has a noted rash, or this patient has a not responsive. Those are things that are quite tricky for what we would call a rule-based system to pick up, you know. So using AI, using that natural language processing, where you can leverage AI to read some of that non-structured data, can drive very meaningful outcomes. So you mentioned earlier, you know, how can pharmacists use this type of technology improving the patient care? Well, if they have this toolbox with the natural language processing, that can help them understand which of their patients are experiencing side effects of some of the treatment I mentioned earlier. Dexamethasone sometimes can have significant side effects. So if they go into some sort of central nervous system reactions to a steroid, these are not things that you can capture on the laboratory result. So really, it will be dependent upon the ability of having the program algorithm to read the notes that the nurses are charting or the doctors are recording, so that the system can pick it up and notify the pharmacist, hey, this is a patient who may be experiencing a side effects to the medication, and maybe we need another pair of eyes on it to see if there's an alternative treatment for that. Similarly, you know, you mentioned earlier, looking beyond the pandemic, how would that change the way that pharmacists would utilize technology to help their patients? I think, again, going back to the way that we think about that larger framework when we first talked about this, you know, how can we identify patients who may potentially have some of these medication-related problems because of the genomics, right? Pharmacogenomics is another area where we hear a lot of interest and activity. So how can we leverage some of this advanced technology to read very complex information in the human genome and unlocking those sequences that have been correlated with particular side effects of the medication, so that we can change the utilization of those drugs, looking at the identification of these side effects once they have occurred. You know, are there any early signals that we can leverage to identify a patient who's about to have kidney failure to antibiotics before you can see the manifestation? You know, even if you can catch it 24 hours earlier, you can stop the drug earlier and stop the continual assault on the kidneys. So I think those are areas that are very promising for pharmacists to be an advocate for the patient in managing their medication therapies.
Are there currently any impediments or challenges in being able to expand AI capabilities?
Great question. With regard to the obstacles and challenges, I think a lot of the electronic health record, especially when we translating it from the hospital level to the individual clinics or outpatient areas where most of our patients are seeking their care, I think the interoperability is still a problem. We are seeing that if your primary care physician and your hospitals are not on the same electronic health records, they're not able to see or data element that is incomplete. So I think that remains a challenge as the healthcare industry we need to resolve, to make sure that it doesn't matter if the information is stored on one brand of electronic health record, that needs to be easily translated into a second electronic health record, so it's not dependent upon the patient's provider to be in the same ecosystem to get all the information. I think the other thing that we need to have a more frank conversation about is with ourselves as healthcare professionals. I think there's still a lot of hesitancies and fears about using a database or data science-driven approach to some of these innovations. So how can we reduce the friction where we are not positioning the technology as a replacement or as a competition to the prescriber or pharmacist autonomy, but rather these are tools that will help augment them in the clinical decision making, so that they can make the best decision based on the best data available. I think that change management will be a big hurdle for us to overcome, both on the provider side as well as on the healthcare consumer side.
How do you envision AI functioning in healthcare in the near future?
We had talked a little bit already about the treatment and the management of these different disease states. I think precision medicine is going to become more and more prevalent. I think people will demand that the treatment plan be tailored and be specific to you as an individual, instead of if you have this particular heart disease, go to drug 1, 2, and 3, and everyone gets put on it. I think people would expect and demand that that the treatment will be based on the best data available for your demographic, your age, your organ dysfunctions, the other diseases that you may have, other drugs that you're taking, so that the treatment will be much more personalized and your treatment plan will be much more robust in terms of the monitoring, because as there are more and more advanced medications become available in the marketplace, I think the management of these drug-drug interactions and side effects are becoming more and more complex. So I think having that robust technology to help your pharmacists and your physicians to identify any potential problem before they start, or if there is a problem that has started, that they would expect that the identification will be much earlier in the course of the disease and this treatment plan. Really appreciate your interest in this area. I think there's a lot of promise and certainly a lot of the application that we have already been able to even deliver in the marketplace. One of the things that we're just wrapping up is a pilot project in being able to use an AI algorithm to identify patients who may be at risk for developing an infection that is common in a hospital called C. diff. And we are so excited to see the precision and how much earlier our model can detect someone who may have be at risk for having an infection. We can even identify those patients even before they have symptoms. So a project that has really rapidly moved from a proof of concept to being piloted to being made available to our customer as early as next month. So I think we're not really talking in the abstract here. We're talking about things that are coming to the market and people will have access to these tools. And I think that's what excites me, to have the opportunity to talk with you, about things that we are putting in the hands of our clinicians and use it to improve patient care.
Awesome. Steve, thanks so much for joining me today and your continued work as well.
Yeah, thanks very much.